What does it take to move health equity from a buzzword to reality? For some, it starts with a family member's struggle. For others, it's a moment of outrage at injustice. From PHI Media, I'm Gordon Thane, and I'm joined by Dr. Jamila Porter and Kay Schaffer of the Beaumont Foundation, two leaders whose paths were shaped by personal experience and a drive to make public health work for everyone. Jamila's journey began with her grandmother's battle with a chronic illness, leading her to rethink how systems and communities shape our health. Kay's story is rooted in a passion for justice and a belief in listening to the voices behind the data. Together, they're challenging the status quo, asking if we're really equipping the public health workforce to advance equity, or are we just talking about it? Let's get into the conversation. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Jamila, Kay, welcome to the Public Health Insight Podcast.
Thank you for having us.
Happy to be here.
Jamila, so I understand when you were younger, your grandmother was dealing with diabetes and managing that as a chronic disease. Can you tell us about how that life experience early on shaped your interest for the health-related sector?
That was my mom's mom, and that was a chronic disease that she was coping with. And so we all pitched in to support. And I think that those experiences, just seeing how my grandmother had to care for herself, had to cope with this chronic illness, but all at the same time she was also taking care of everyone else and was always putting her immediate needs on the back burner in a lot of ways, I think shaped my sense of empathy around health and around what's necessary to help people have better health. But I think interestingly at the time, it kind of bisects. So you could either go down the path of wanting to support individual care, become a physician, which is something I thought about doing. And then because I went to undergrad and had a health policy class, it actually took me on a different path. And so my grandmother's experience made me care about health, made me want to work in the field in a way of helping people have better health. But then my collegiate experience really drove me to population health and helping entire swaths and groups of people in ways that could be widely impactful instead of just focusing on individual clinical health.
And tell me about, there was a course that you took while you were in your bachelor's degree, Introduction to Public Health, that also played another role. Is that what you were referring to and how that evolved your thinking?
Yeah, it was like Introduction to Health Policy. It was interesting because it wasn't explicitly called public health at Wake Forest at the time. So but once you got in that class, it was clearly an intro to public health class. It was all about population health, epidemiology, surveillance, policy. It was an amazing class.
Was that an elective or something you had to take in your bachelor's program?
It was the first course of what eventually became my minor. So I minored in health policy and administration.
Okay. We'll come back to how you evolved from there. So as far as you, Kay, take me down memory lane before your Bachelor's of Arts in Human Rights, but when you were a student at Bard High School and you had the whole world ahead of you. What were you telling people at the time when they said, Kay, what do you want to be when you grow up? What were you telling people at the time?
Yeah, so when I was thinking about what I wanted to do with my career, I always knew that I wanted to work in a space where I could be contributing to the greater social good. That took a number of turns. When you're younger, you think, the world is really yours. So for a while, I thought I wanted to be the first female president of the United States, which is something my mom loves to remind me of. And then I thought that maybe the way that I could have the greatest impact was becoming a lawyer and focusing on international human rights law.
Wow, okay.
I had a number of experiences both within my undergraduate degree and right after that allowed me to see what it looked like to work at the systems level and thinking about global human rights issues. But I always found myself interested in issues of bodily autonomy and reproductive and sexual health. That was really where my passion for health first emerged. I remember trying to figure out what I wanted to write my senior thesis on in college and reading an article about the survivors of coercive sterilization programs in the United States who were fighting for financial restitution for the trauma that the state had inflicted upon them, and feeling like this was the most angry I had ever been about anything in my entire life. And wanting to follow that passion for writing what felt like such a deep injustice to me, either through what ended up not being legal means, because I took a practice LSAT and realized that that was not where my strengths lay, but ultimately learning about the language of systemic oppression and systemic health disparities, and realizing that that's really where I wanted to make the biggest impact. So I went and I got my master's of public health in maternal and child health, and learned all about research and the ways that I could harness the curiosity that I had about different topics in a more process-oriented way to engage with people, to hear about what was really important to them and what we could work together to do something about that, which then landed me working at Beaumont with Jamila for the past 3-4 years. Jamila, it feels like we've been working together forever.
I don't know.
I don't even know.
It's going. Yeah, it's getting. It might. I think it's going on 5.
Wow. That's going on 5 years.
Happy anniversary to us.
I know. You can also still be the first female president.
Unfortunately, that's still true. No, thank you.
You don't have to give up on that dream.
No, we'll see.
Going back to your MPH experience, Kay, was there a course that you felt blew your mind in terms of your approach to public health and how you saw yourself making an impact in the world? Obviously, now you're very focused on research and evaluation. Was that the case as you were going through MPH as well? Like that particular discipline struck the nerve with you in terms of something that you saw yourself doing?
My maternal and child health evaluation course definitely opened up my eyes to a lot of ways that I sort of was naturally thinking about problems and how we could set up systems to understand if programs were achieving what they set out to achieve and if it was really affecting people's lives for the better. So taking that course gave me the tools that really allowed me to step into the role that I am now. But I think the course that had the most impact on me was a advanced qualitative research course that I took. Going into my master's of public health as someone who's naturally more qualitative in nature, I really felt like research wasn't a space for me. And learning that there were ways to listen to what people were saying and analyze that in a systemic way and produce evidence that was valued just as much as the randomized controlled trials that I was learning about really showed me the space that I could step into in public health. And in a way that I really never expected to. So that was a really great experience for me.
That's refreshing to hear. My research interests were sort of ruined in my undergrad. It was the wet lab stuff, pipette, and my supervisor, I don't think, was very nice to me, and that just turned me off of research altogether. And then I do public health. I'm like, there's other kinds of research you could do? But by then, it was probably too late. I'm more of an implementation science. I'll take the evidence and do something with it versus generating the knowledge through research. So I leave that up to folks like you who are more skilled in that area. So Jamila, in terms of you, right? So you have that public health undergrad course that opened up your eyes, but your public health learning didn't stop there. You went on to do an MPH and a DRPH. What's the story behind that?
Well, after minoring in health policy administration in undergrad, it just seemed obvious like my next step was to go and get an MPH. So I went and earned my MPH at Mercer University School of Medicine, and with a concentration in community-based health. And it just seemed like a natural progression when I think about it. And then after that, I really was bitten by the public health bug. So I knew eventually I wanted to earn a DRPH.
Mm-hmm.
And I remember learning the difference between a DRPH and a PhD, which is just that DRPHs actually implement, just like you were talking about with
Yes,
implementation
yes,
science. So we
yes.
do generate research, but it's
Mm-hmm.
research that's meant to be applied
Right, right.
for the good of people's health. And so that was something I had always wanted to do. But after I got my MPH, I actually worked for several years. At the time, I didn't realize how useful it is to have real work experience before you go back to get a doctoral degree. But yeah, I worked in private industry in doing consulting, basically health consulting, and when turning fee for service into managed care. So I worked in the healthcare field, but doing very much what I didn't know then was health equity work, basically health education amongst with pre-K, with low-income families. And then I did that for a couple of years. And then I went on to work at the Safe States Alliance, which is a National Association of Injury and Violence Prevention Professionals. And I was doing that role for about 5 or 6 years and then decided to start getting my DRPH while I was still working. So that ended up being a really amazing meshing of worlds because I was working in a lot of different areas of injury and violence prevention, particularly in community, basically at the intersection of built environment, community design, road safety, transportation safety, and road transportation policy, and then applied that in my doctoral research. So that's what my dissertation focused on. So that was some kismet there. Those experiences were really good. And I highly recommend anyone who's thinking about getting a doctorate to work first. That'll help you know if you definitely want to do it, and if so, what you want that area of focus and your research of interest to be.
I'm glad you zoomed in on that because we get a lot of people asking who maybe just finished their Masters of Science in Public Health or MPH, and they're wondering, should I dive deep into a DRPH sort of right away? And it's nice to hear feedback from people like you who are saying it actually broadens your perspective and horizons and actually puts you in a position to get more out of your DRPH when you do it. So I really appreciate you bringing that. So both of your stars collide, the Beaumont Foundation. You mentioned you've been working together for 4 or 5 years or so. Can you break down what the organization is and then your specific roles within the organization?
I can speak a little bit about what we do at Beaumont. So the Beaumont Foundation is a private philanthropy based in Bethesda, Maryland, and it was endowed by a gentleman named Pete Beaumont, whose focus was always on providing practical tools to solve some of the world's biggest problems. A fun fact that we all sort of like to tell about Mr. Beaumont is that he founded the Brookstone Company. So when you think about the stores at the malls with all of the gadgets that you can use to make your life a little bit better, that was his original company. But once the foundation was endowed, it shifted its focus to thinking about practical tools, particularly for public health professionals, because that's the area where Mr. Beaumont felt his resources could have the biggest impact. So the foundation currently focuses its work in 4 main domains or pillars. We work to advance policy by improving the health of communities and working with them so they can live their best lives and thrive. We do that mostly at the local level. We are a nationally focused foundation, not a federally focused foundation. So we work in specific places with specific communities to ensure that they are working towards goals that benefit them most and that are directed by them as well. We also work to create partnerships. So that is often done amongst unlikely allies and working across sectors to help those leaders achieve a shared goal of strengthening their communities. We do that by funding various pilot and demonstration projects that connect public health to other sectors that might not be talking to one another naturally. So working to break down those silos. Another area of our work is strengthening the public health workforce, particularly those who work in state and local health departments, which we do by understanding their needs through various surveying and research efforts, as well as producing tools and resources designed specifically to help them do their work better. Our main survey being the Public Health Workforce Interest and Needs Survey, or PHWINS, which we're going to talk all about in a few minutes. And then finally, we work on improving communication for public health professionals. So empowering health communicators and building support through public health, through research, training, and other areas of their work where they might need some support. And Jamila, anything else to add to the general de Beaumont overview?
I think you hit all the notes. Yeah. So all that to say, the Beaumont Foundation is very much focused on public health practice and ensuring that that's everything to Kay's point, that we generate research, tools, and other resources that are intended to support public health practitioners, particularly those working in governmental public health, but beyond, as well as communities at large. And that's what Kay spoke to in terms of a lot of the locally focused work that we do around policy and partnerships.
So now onto your role. So that's like the big birds in the sky. I imagine that your portfolios have a specific focus within that large mandate. So Jamila, chief of staff, principal investigator. I've never heard of a chief of staff in public health before, and I'm excited because people are always asking me, what are some job titles in public health that I could do? So tell me about your role as chief of staff, and then the principal investigator hat that you wear as well. You have a specific project that you're also focusing on at MAID, I think it's called. So feel free to jump into all of that.
Sure. So I wear two hats at de Beaumont. The first that you mentioned, Gordon, is chief of staff, which a chief of staff role can look different in a lot of different places, in a lot of different settings. In de Beaumont, I describe that role as really trying to be the connective tissue between the work of our various teams within de Beaumont who are working on programmatic work, on evaluation work, communications, and also our executive office. So our CEO, Brian Castrucci, the office of the CEO is his office. And so being that connective tissue between all of those teams so that everyone's needs and priorities are well understood and that folks are able to work even more effectively cross-collaboratively. So that is a really unique and fun role to take on. It's a unique challenge to take on, to stay informed about everything as priorities change and evolve, and also as we cope with a lot of volatility in public health. And then my other hat, equally worn, is I'm principal investigator of MAID for Health Justice. MAID is an acronym that stands for Modernized Anti-Racist Data Ecosystems. And we are working with several communities who are all working to build out health-focused local data ecosystems that are expanding our understanding of civic data. And civic data are just data that describe the reality of our lives, where we live. They're used to inform public transportation routes and the cost of housing and how much money schools get. So these are usually data that we might think of as being housed within government agencies, but MAID is really focused on ensuring that these sorts of data are community governed and community driven. And so we're working with 4 communities in Baltimore City, Pittsburgh, Portland, and Tucson to pilot what it would really take to create data ecosystems that are truly community centered and community led, and to expand and enhance civic data so that it can be used to make decisions that really improve people's lives and their opportunities and access to various resources across the social determinants of health.
Okay. I might have to pick your brain on that later. At work, we're also looking at data governance frameworks and involving communities, and I've been trying to expand my network in that area. So we'll put a pin in that one.
That sounds great. I know 4 communities that are doing some great work in that space.
Awesome. And then Kay, yourself, tell us about your role.
Sure. So I'm a research and evaluation officer at the foundation. I've been at the foundation for about 4.5 years and have had sort of 2 distinct roles at de Beaumont. For the first 4 years, I worked primarily on our research evaluation and learning team, which mainly focused on the Public Health Workforce Interest and Needs Survey, or PHWINS, which is a nationally representative survey of all governmental public health practitioners, so people who work in state and local health departments. In that role, it was really cool and unique because I got to really see a survey from start to finish. So thinking through how do you gather feedback from numerous partners with competing priorities, actually develop the survey questions, test it, program it, recruit, field, everything that goes into collecting those data. And then the so what. So now that we have it, how do we analyze it and how do we put it in the hands of practitioners so that they can have rigorous evidence to advocate for themselves and the needs of their health department? And how can we use our voice as philanthropy to help elevate their needs to a different audience? So that was my role for 2 fieldings of PH Wins. The survey has been fielded 4 times over the past 10 years. Within the past 6 months, I've shifted my role at the foundation to my current position as a research and evaluation officer, where I'm starting to think more with an evaluative lens. So working with program leads such as Jamila and others to think about what are the ways that they can measure the impact that their work is having and how can they tell that story. So that depth within the programs that we have at the foundation. And then how do we look across all of the work that we do in different areas and think about our collective impact? And how do we hang all of our programs together to tell that story of the work that Beaumont is doing to both our partners in philanthropy and the public?
Awesome. PH Wins sounds like a good cliffhanger to go into our next segment, which I didn't tell you about on purpose. It's called Insight Blitz. It's a rapid fire segment where I'll ask you very short questions or read very brief statements to get your reaction and a brief response. So, ready to get going? Are you feeling scared? Don't be scared.
Oh, we're fearless.
Excited.
That's what I thought. This is a piece of cake. All right, so let's begin. Okay, I'll start with you. What's harder, being a student or a professional?
Whew, that's a great question. I think that being a student is harder because of homework. Homework can be a lot, to be totally honest.
And you're not getting paid for the homework.
Exactly. I'm actually paying you to give me homework. So
That's fair. For what it's worth, I've spoken to some professors who said the same thing, that being a student is harder than being even an educator. So seems like if there was a right answer, you picked the right one.
okay, good.
Jamila, pick only one. A visit to a planetarium or watching a documentary about cosmology?
A visit to a planetarium. You've done your homework.
That easy?
I love both of those things.
But you picked it quite easily, the first one.
Yeah, because going to the planetarium is amazing. You get to, and you might also get to look in a telescope and see like Saturn or whatever planet is visible from like a basic telescope. You could actually see a really big one. I'm thinking of Griffith Observatory. So I would never pass up a chance to go to Griffith.
Well, I was going to ask you for a recommendation, and you gave one there. So, okay, we'll put a pin in that one.
In LA. Get there.
In LA. Get there. All right. Okay, pick one. New York or Maryland?
New York.
And you could rationalize it however you want. It's vague on purpose.
One word, bagels. That's all you need to know.
Fair enough.
I don't know. You're asking a lifelong New Yorker that question. I currently live in Washington, D.C., but New York will always have my heart.
All right, New York wins. Jamila, if you're choosing a career in an alternative universe, would it be a physician, an astronaut, environmentalist? Which
astronaut.
One? Oh, these are too easy. You already knew.
Yeah, I think.
It ties into your previous answer.
Exactly. There's a theme here. In an alternate universe, I am either an astronaut or a cosmologist. So that works for me.
All right. Sounds good. Okay, true or false? Evaluation leads us to an objective truth, not a subjective one.
I would say false because I think that it's impossible to be objective in evaluation because of the identities and experiences that we all bring to our work.
Okay, fair enough. Jamila, you're hosting a dinner party with your personal heroes. Who's at the table? And you can't pick Captain Planet or the Planeteers. That was a great cartoon, by the way. I was watching some episodes like a year ago, and the level of depth of stuff that they would get into that went over my head as a kid, it was incredible. But anyway, sidebar.
I know, right?
Back to you.
They have to be alive now or no?
No, dead or alive, and I'll give you 3 chairs. You're
Three
in
chairs.
one of the 4 chairs, and you've got 3 empty chairs. And
Okay.
Kay nor I will be there. We're just busy at the time that you're having
Oh,
dinner, so you have
that's
to pick.
We know you
someone
would have
else.
invited us.
We
so
know,
we'll
we know
gracefully
you would have,
bow
but we
out.
want to take that hard decision out of your hands, so you have 3 free seats.
Okay. Ooh, 3 seats. Okay, the first that popped in my head was Mother Teresa, just because I actually volunteered in Calcutta, it's actually called, and so she was just so brilliant and so giving, and I would have loved to have met her. The next one, oh, these can't be family members either, right?
No, you pick.
Okay,
Just
my grandmother is
just not
at
the
the
2 of us.
table.
Your grandmother,
Grandma's
okay?
at yes, my mom's mom. And then I'm gonna pick Betty White because I love comedy and she was hilarious. And I would have loved to have interacted with her and have some levity at the table. We're gonna talk about some serious stuff, but then we're gonna
Right.
have some humor and some
Yeah.
jokes.
Oh, that's probably one of the best dinner table answers I've heard. Very balanced, and I would want to see how that went down. Kay, a key lesson you learned from attending the 2025 Grantmakers in Health annual conference recently.
I'm just reflecting. That was earlier this year. Let me see. I'd say that so much of the field currently is thinking about the ways that we can invest locally and to go deep within the communities that we're supporting, and how can we. A number of the speakers and presentations talked about how we can provide sustainable funding at the local level, which is something that I think we've talked about in philanthropy for a long time, but given the current political context and challenges, hearing a relatively united front of both people who work in philanthropy as supporters of work and as direct funders saying that same message in what felt like a very hopeful way was very refreshing to be a part of and to get to listen to and participate in.
Jamila, if I have this detail correct, hopefully I have this detail correct. You have an upcoming book. Yes, no? All right.
Yes.
So I think it's going to be called Advancing Equity and Justice.
That's correct.
Describe it in 1 sentence.
The book is a call to action to public health practitioners and anyone else who's doing work in the field of community health to take on the role of public health as a social justice institution, and one that is and must be informed by community leadership.
Okay. All right. Sounds like you were almost ready for that one.
I have not seen these questions.
No, they have not seen these questions. I really tried to stump them, but I couldn't. So that brings us to the end of Insight Blitz. That wasn't too bad. You're still here. You're smiling. Seems like we're ready to go to chapter 2. I'm seeing some nods. Yeah. Okay.
Absolutely.
What we've heard is what drives 2 people to public health. The stories, the journey, and the hope for something fresh, something better. But understanding why is just the beginning. Coming up next, we break down the Public Health Workforce Interest and Needs Survey, otherwise known as PH-WINS. We dig into what the data really says and explore how public health can move beyond ideas to impact. That's next time on the Public Health Insight Podcast. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.